As my liver condition deteriorated, my ability to even perambulate, to walk around, was diminished dramatically. I used to spend my life asleep in a chair at home because I had absolutely no energy at all.
For a period of about 3 months, I put on a massive amount of weight, probably about 3 stone. It was affecting my breathing dramatically. I was never upstairs in my home for almost 6 weeks. I slept downstairs in a large armchair because I couldn't face going up the stairs.
I lived some 20 miles away from the hospital, but as a patient with a liver disease, I was incapable of driving myself, so I had to rely on my wife to come from her employment to take me into the hospital.
Since I was first diagnosed, the amount of times that I've had to come to the hospital to be analysed is around about the 20 mark. Every time I come to the hospital, I literally have to write off a full day.
The D-Liver project has been set up to develop an entirely novel approach to being able to monitor patients with advanced liver disease in their home environment, to collect important information about their blood tests, about their weight, about their concentration and their brain function, and then to use that information both to inform them about their disease, but also importantly to inform decisions about how their disease might be better managed.
You get the feeling that out of 24 hours in hospital, maybe an hour of that is taken up with medical attention, and the rest of it seems to be lying there, bored out of your skin.
At present, we tend to get information in a delayed fashion. We measure tests in an outpatient clinic, and then we wait for the results, and then wait to feed back the information to patients.
You just feel it going tight on your arm?
The more and more I became ill, the more important it was to have real blood results, and so I was required to come in on one day to give some blood samples for analysis, and then return the following day to have those results analysed and reviewed with my consultant.
The vision is that we automate that we put the measurement of tests not into hospital clinics where people have to take several hours to get there and go home again. We put it into their home where we can measure the tests, we can interpret the tests, we can feed the information back to patients, and we can change their management all in real time in the person's home. In the Monday morning model, I see myself arriving in the clinic and for the first hour not seeing patients, but reviewing the data for all of the patients under my care with the D-Liver system, which might be hundreds of patients, interacting with those patients, many of whom will be fine and whose blood tests we can simply reassure them about, making decisions on those people we need to make decisions on, and then seeing the people we need to see. There's also an important factor about concern and security and risk in patients. I've spoken to many patients who tell me how frightened they are. What will happen to me on a Sunday if I feel encephalopathy coming on? What do I do? Do I phone my GP? Do I go to an accident emergency department where they don't know me? What this system allows you to do is to activate it yourself. If you're worried about the disease, you can trigger the test being done, you can have the information fed back to you, and that information is also passed on to the clinicians who will review it the following day. You are in control of your disease, you can have small adjustments introduced to your care when you need them at the very beginning of the episode.
My wife and myself would have felt really, really comfortable with the data that was up to this point was invisible to us and was distant and remote and inaccessible. And as a moderately intelligent individual, I want to have the information because I want to see it, I want to be able to understand it. Having had my transplant and returned to work, I haven't effectively escaped. I still come to the clinics every 6 weeks because my employment requires that my medical condition is very, very sound. So I see my consultant every 6 weeks, but yet again, I have to have a blood sample first, and then we discuss it 2 or 3 days later in the consultation. Active involvement in my own care would be a boon to me.
So a model of real-time information and constant adjustment is highly exciting. The resource issue is very important. One of the costs that we have with laboratories is associated with doing small numbers of tests. You have to use the whole of the infrastructure of the processor to do a single test. So it's very inefficient to do single individual investigations. A system that allows you to be able to do those measurements when you need them in the home environment will save investigations being done in a more costly form in the hospital environment. I feel that this technology, once the technical hurdles are crossed, will be applicable with slight modifications in lots of diseases. We're affected in the population by a huge rise in the incidence of chronic disease that really limits the ability of people, perhaps in the later years of their lives, to have a high quality of life. They lose control of their disease, they give control to other people, and they live their lives revolving around how they're going to manage the disease. In all of these disease areas, technology can give them control of their disease back again. And I think it will have the ability to combine better care, more control for patients at lower cost. And who could argue with that? The power of dLiver is to completely change the paradigm for the management of liver disease. More information, more frequently, more rapidly, and more reactively treated is the future in healthcare.